We did a trial where we were looking at anxiety, and we're looking at stress, and we're looking at cognitive function. And we thought, well, should probiotics have an impact on that? We weren't really sure, but we did a trial to see if we could see anything. We measured two types of anxiety. One is the adrenaline and cortisol type of anxiety or stress, like flight or fight, or if you're having a bad interview, it's that kind of stress. Then we measured another type of anxiety that I'd never heard of, called trait anxiety. Anybody heard of that? Well, trait anxiety is this thing whereby, sometimes like in a month, you might have 2 or 3 days where you feel vulnerable and threatened and anxious about virtually everything. You feel a bit blue, depressed, and then 2 or 3 days later, you feel much better. Your circumstances haven't changed, nothing's changed, but your perception of them has changed. Do you know what I'm talking about there? Sometimes you have 2 or 3 days where you just feel vulnerable and anxious and fretful and a bit down. That's trait anxiety. So what we did was we gave this product, one of our new products, 50 billion probiotic. We gave this to 50 healthy volunteers for 6 weeks. What we found was we got a significant decrease. We didn't have any effect upon the cortisol and adrenaline stress. We had a significant decrease in trait anxiety. We got a significant increase in attention span. So the first time that any probiotic has been shown to have an increase in attention span. Always, 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 always give probiotics with food. With food. Always give probiotics with food. I'm just trying to trick you there. Not on an empty stomach. And the reason is this. The empty stomach is bathed in hydrochloric acid. Part of the function of that is to provide what we call a bacteriostatic or bactericidal barrier. If you put a probiotic into the empty stomach has a pH of about 1.8 to 2.6. That's really acidic. If I put you into a bath of acid, you wouldn't like it very much. So these bugs don't like it very much either. When you eat, you produce more acid. But the neutralizing capability of the food means that the stomach that's got a little bit of food in is less acidic overall. The pH rises to about 3.5 to 4.2. So what happens? If you give probiotics on an empty stomach, as is shown here, this is the empty stomach. Even with our probiotic, we find that there's this dramatic loss of viable cells. And that's a logarithmic scale. So it's 99% loss. 99%. Which means that you're not going to see the right outcomes. It means that the person buying the probiotic is wasting their money. If you don't take anything more away, then take this away. And this is what we can see. If you give probiotics with food, it doesn't have to be a full meal, just a little snack, then you get 100% transmission of the probiotic organisms from the stomach to the small intestine. It's the best and easiest thing you can do in terms of looking at probiotics. Don't give probiotics on an empty stomach. What do I mean by with food? I mean just before food, 10 minutes before you start eating. No more than that, 10, 15 minutes max. Or when you're eating food, that's fine. Or within half an hour to 3/4 of an hour of completing the food, when the food is still in the stomach, that's when you take the probiotic. If you had breakfast at 8 o'clock and you're having lunch at 2 o'clock, don't take the probiotic at 11 o'clock. Yeah? Yes? Okay. If you don't take anything else, take that one away. Right. Let's look at our, now, running out of time. Okay, let's look at our probiotic strains. We talked about Lab 4. For our baby products, the pregnancy and baby products, we have a slightly different profile. So the baby products, our ProVen Lab 4 here contains 2 strains of Acidophilus, Bifidobacterium bifidum and Bifidobacterium animalis. The ProVen B that we use in the pregnancy and the baby trial contains Lactobacillus paracasei and Lactobacillus salivarius in place of the acidophilus. Those are the two differences. And so for pregnancy we call it Lactobacillus and bifidus. For our adults we call it acidophilus and bifidus. Okay, that's just some stuff about us. We won't go into that. One of the things that we do, we have the ability, we have a process that we call triphase, which is unique to us. I mentioned it earlier on, whereby we can keep our probiotics stable at room temperature for 18 months and we still reach label claim. Don't need to say any more than that. Ambient storage, 18 months, still reach label claim. So, let's look at some of our products quickly. We'll go through them. So acidophilus, adult acidophilus and bifidus, 25 billion. Our hero product here, this one here. You've seen it used in our trials. We use it on C. diff, we use it on IBS, we use it on antibiotic-associated diarrhea. It's our hero product. Everywhere where we sell ProVen, this is our best-selling product. 2 capsules a day gives 25 billion. So you can have the option of giving two capsules a day, like I was mentioning with IBS, or 1 capsule a day gives 12.5 billion. We then have 2 products alongside that contain the same amount of bugs, but these are in a sachet product. So here we have an intestinal product that's in a sachet, and this is like a general intestinal support. It's a niche product compared to our hero product here. It's a niche product, but it contains fibre, it contains glutamine in terms of a total intestinal support product for people who want a more comprehensive support of the intestinal tract. So it contains 3 grams of fibre, 1 gram of glutamine, and it is for people who want to have a more total care, if you like, of the intestinal tract. Then we have this product here for immune and energy. It contains B vitamins, it contains CoQ10, and it contains caffeine. 100 milligrams of caffeine, like a good espresso per sachet. And it contains beta-glucans and elderberry for the immune system and vitamin C. This is a type of product I give to people recovering from the flu, where you want energy and you want to stimulate the immune system at the same time. It also includes, clearly, our probiotic. Okay, next one. Fit for school, you've just seen that. Did it taste all right? Yeah. Tastes nice. So that one tablet a day. We also have a sachet form of that, or a stick pack form here, because you don't give the tablets to kids below 4 years because of the choking hazard. But if you want, you can give this product to kids from any time from 6 months onwards. And so if you're giving them 6 months onwards, just use the stick pack version, put it in their milk or in their juice or whatever they're having. Same formulation. So we've gone through the ProVen product. We've gone, where's it gone? Leave it over here. No. Yeah. So we have two ProVen products for pregnancy. This is the one that was used in our Swansea trial. This is one that contains the same bugs, but it also contains multivitamins and omega-3 DHA for complete pregnancy care. So this is the product I would advise, if you can, the pregnant woman to take throughout pregnancy. That contains all the vitamins and omega-3s and probiotics that she needs. This is the one that was used in our trial. She can use this throughout pregnancy as well. It doesn't need to just wait until 3rd trimester. If you're taking this, which is just the probiotic, if they're taking Pregnacare or any multivitamin or omega-3, then they can take this alongside it. What this does is it means they don't have to take Pregnacare. This provides all of the vitamins and omega-3s and more that Pregnacare will provide, but it also provides the probiotic too. Okay. So then we have the 2 products for babies. These are 2 products here. One is for breastfed babies, one is for formula-fed babies. The formula-fed product contains a thing called GOS, or galacto-oligosaccharides. And the reason it contains that is because breast milk already contains these galacto-oligosaccharides, but formula milk doesn't. So we don't need to add it to the formula for breastfed infants because the breast milk already contains it. But we do need to add GOS to the formula milk because the formula milk doesn't contain it. We've got a product for toddlers here. And again, this is the probiotic. It's got GOS in it as well, and it's got multivitamins. So 100% RDA of multivitamins. And we've got here, do you have multibiotica over here? Okay, where's it gone? So we have multibiotica in the UK, and multibiotica, or its equivalent in Europe, is a huge seller. Most people buy multibiotica as a multivitamin, yeah? And probiotic, okay. Well, multibiotica contains virtually no probiotic. It's got 20 million. We've got 2.5 billion in this product per capsule. So it contains a better multivitamin array or spectrum than multibiotica has, and it's got a significant level of probiotics. So it's the real deal multibiotica, if you want to call it that. We also do the same thing for people over 50. No, we don't. We don't do the same thing for over 50. We don't do it. Of course, because of ginkgo biloba. Why did I forget that? We do a children's product. This is not the product to prevent coughs and colds during the winter. It's a lower level product. But if you want to give a child a multivitamin, a full spectrum multivitamin, and some probiotic, a bit like a multibiotic for kids, then this is the one to use. But it's not the one to use to prevent coughs and colds. That's fit for school. We have a travel probiotic, easy one this, 14 capsules. If you're going somewhere like Italy, you take one a day. If you're going somewhere like India, I was going to say you take a pack a day. But you take probably 2. If I was going to go to India, again, I've been to India a number of times, actually it's pretty good, but I would probably take 3 or 4 a day. So just what I'm saying there, it depends upon the risk factor. New products, so we've got the 50 billion here. I told you we use it for cognitive function and we use it for antidepressive effects. I also use this now for complicated antibiotic use, and I use it for severe IBS. So complicated antibiotic use is where you've got a powerful antibiotic or you've got sequential use of antibiotics. You know what a lot of people do? Well, a lot of people are on one antibiotic followed by another antibiotic followed by another antibiotic. This more complex antibiotic use needs a more intensive therapy. So I use this for complex antibiotic use. Again, contains 14 capsules. This is a product for women. This contains everything that's in our adult product. Everything that's in our adult products there. Everything that's in our adult product. But it also contains another organism called Lactobacillus gasseri, which is specifically for females. It's a vaginal isolate specifically for females. So imagine this product as being our hero product plus the Lactobacillus gasseri specifically for vaginal health, and the cranberry again specifically for genitourinary tract health for women. So take a typical example. Say a woman has got IBS. You'd normally give her this. Let's just say she wants something that she's got some issues with regards to, or she wants a more directed female health product. You'd give her this instead because it contains everything that's in there plus the vaginal isolate and cranberry for that genitourinary tract health. Enzymes. Probably one of the things that in Europe, if you've got indigestion, very often what they prescribe is enzymes. Enzymes, protease, amylase, and lipase. Protease, amylase, and lipase. These are the enzymes that you need primarily to digest food. If you've got indigestion, you take enzymes. Most people in Europe do. probiotics are a natural companion to this, so we've produced this particular product. It works really well for indigestion. And then finally, Cardiobiotic. This is a great product. Probiotics have been found to reduce cholesterol. We've actually published work on this, and our strain Plantarum can reduce cholesterol, and this product here, this strain here, Lactobacillus reuteri somewhere, can also reduce cholesterol. It's where I tend to use this is not when somebody is being prescribed statins, but if somebody has high cholesterol level but it's in the high to normal range, still normal, it's normal but high within the normal range, give them Cardiobiotic. There's no problem about giving it alongside statins either. In fact, the probiotics decrease cholesterol by reducing the absorption of cholesterol from the gut. Statins do it by reducing the synthesis. So they actually work together very, very well. So if somebody doesn't want to be on statins or they want to have something to assist the way that statins work, Cardiobiotic is a great choice. Finally, value for money. We're talking about our probiotic range. I think we've got the best probiotic range from an evidence point of view anywhere. But is it value for money? So what I did was I took two products here. Have you heard of these? Alpha-X, Aflorex, and Afterbiotic. Let's do an analysis quickly. In Alpha-X, there's 30 capsules per pack. There's 1 billion organisms per capsule. So there's a total, if you do the maths, total amount of 30 billion organisms per pack. That costs 33 euros. That's a lot of money. That means that 1 billion bugs cost 1.1 euros. They're really expensive bugs. If you look at Afterbiotic, 10 capsules in a pack, 6 billion per capsule, so 6 times as much as this. So the total number in a pack is 60 billion. It costs 6.75 euros, so each billion costs 0.11 euros. So a tenth of the price there. And then our probiotic here, our adult probiotic, 30 capsules in a pack, 12.5 billion per capsule, which means we've got 375 billion in a pack. Ours costs 16 euros, which means that per billion it costs 0.0430 euros per billion. You work that out, Alpha-X is 25 times more expensive than ProVen on a bug basis. And Afterbiotic is 2 times more expensive than ProVen. And they don't have as good of evidence. In fact, the trial that was done in Cork on IBS is not as good as our trial on IBS. Even that. Forget about the C. difficile and all the rest of it. It's not as good. Okay, in summary, guys, what can I say? I mean, I think that what I've hopefully done is giving you a bit of insight into our microbiome. I think that's the most important thing to do today, to give you some insight and a bit more knowledge. If you understand the microbiota, you understand the microbiome, you understand probiotics. You understand why they work, when they work, and why they don't work. From our point of view, we've been working on probiotics for the last 20 years. So we have I think, the best range. We have the broadest range. We sell to really everywhere in the world now. So have a good stab at dealing with our probiotics. You'll find that they work fantastically well, and that's the acid point, the acid test. They work really, really well.